we're going to go over the Bledsoe custom measurement system. I'm going to go over step by step and then chat about a few troubleshooting tips and tricks of the trade depending on what custom brace you choose. So to start out, you're going to have your patient sit on the bed with the affected leg on the outside, or depending on how your clinic is set up. Today we're going to measure the right leg. We're going to grab the tracing board and this little pillow. Center the pillow as much as possible on the D1 line on the center of the board. And then we're going to slide the board underneath the leg and line the joint line up with, again, the D1 line. What's great about this board and this measurement system is if you do not have the leg straight on the board, the computer system will catch it. However, I obviously recommend that you center the leg as much as possible. Throughout this whole process, we're going to ask the patient to dorsiflex so that we have a bit of muscle definition. So your first set of measurements on your back side of the measurement form are the Bledsoe measurements. We're going to do the circumferences first, which will be along the purple lines. So we're going to grab the retractable measure, or the whatever this is called, measuring tape. And then we're going to tighten the measuring tape snug, not too tight. We don't want it to indent on the leg, but enough that I can't slide my finger through. And then you're just going to record your number on the board as you move along. So snug first line, snug second line, and now the third line, the first circumference underneath the kneecap. Depending on if you're measuring for a custom ligament brace, a dynamic version, you're going to give a centimeter on this measurement because there is a hinge inside the frame. Any other brace, so a non-dynamic ligament and your OA bracing, you'll again do snug to fit. And then on your last circumference, you're going to do snug to fit and make a little mark on their knee to use as a reference point later on in the measuring system. So next, we are going to trace the knee using this red thing. And I will bring this a little closer. So we want the marker to sit flush on the board with this little piece. And then there's also a triangular system on the top. We want the measurements to be done flush along the leg and not on the top of the triangle. So if you do have a patient that has a bit more adipose tissue, feel free to press in, otherwise it's just to touch for the tracing. So you can do individual marks along the lines or do a full line. When in doubt, after you trace and when submitting your file to Olivia, you can take a picture of the board too, just so that Breg can have that as a reference to go off what numbers you would have recorded. So what I like to do after I've traced the leg, I pull this out and I'll set it aside, and afterwards I will record each number. So on the board you have A1, A2, and you have that list on your order form. So I'm just going to set this aside. In the last part of the measuring system, I'm going to ask the patient to stand up. The patient's going to be weight bearing, shoulder width apart, and we're going to use this medieval tool. So the first part, what we're going to do is use that dot we would have made at the last circumference, and I'm going to put the top of this plunger at that dot. So this measurement is snug, not too much pressure. And you are reading this measurement at number 6 on this contraption. You do have a dial to tighten this so that that tension remains as you push in these plungers to touch. So I'm going to push all of these in. You may have patients that have a bit of an angle when you push these in. So ideally, these plungers should be sitting at a semicircle. If you do have kind of an indentation on the medial side, which Brad kind of does, I will pull the plungers out a little bit just to avoid any pressure that might happen with the calf portion of the frame. You'd think that maybe it would be gaping a little bit, but the pad inside of the frame is enough to have that flush against the skin. So I'm going to pull this out and record 1 through 5. And then the very last measurement is hand tool, and we're going to measure knee width. And this, again, if you do have a patient that has a bit more adipose tissue around the knee, squeeze in a bit. We'd much rather pull out a brace than have to bend it in. And these plungers are going to sit where the condyles of the brace are going to sit. So I'm lining this up with the top of his patella, a little bit of pressure, and reading the measurement at number 6. And that is it. That's all.